There we go. Okay, so again, thank you for joining us. So again, this is the second webinar that the McKaylee Center for Sports Injury Prevention is running. Our last one was with Kelsey Griffith on mental skills. And this is our second one for all of our runners out there. And so this is also an affiliation with the Division of Sports Medicine, and we're lucky to have this great panel here to discuss this topic with you. So the McKaylee Center, and part of the Division of Sports Medicine is located at 9 Hope Ave in Waltham, Massachusetts. And we work very well together with all the sports medicine physicians. We have 2 of them here tonight. And Sara Collins is another one of our sports injury prevention specialists and athletic trainers. So just a quick tiny plug for what we're doing over at the McKaylee Center and the Division of Sports Medicine. We have gone virtual, and we have been since the end of March. And so our Division of Sports Medicine has been seeing patients via telehealth, and the McKaylee Center has been offering private training classes and mental skills training. All of those services have been offered virtually. Hopefully over the next month or so, we start to phase back into the in-person visits, but for now, everything is virtual. And the one thing I wanted to kind of highlight, especially for the 4 people that you see on your screen right now, is that we have now up and running the Injured Runners Clinic, which typically was in person, but now we have figured out a way to make it virtual so that we can still see our runners that might be injured. And so we're all very excited that we can now offer that to you and be that kind of give you that support during this time when really it's nice and easy to be able to just lace up your shoes and go out and run. It's probably one of the easier exercise, activities that you can do right now. And so we're happy that we can be here for you. So again, we're talking about running considerations during COVID-19. Our presenters tonight are Dr. Pierre, who is the running guru in our Division of Sports Medicine, and he helped get our running program up and running, no pun intended. And we also have Dr. Kristin Whitney, who's relatively new, but she has literally taken all of this running stuff and ran with it. Again, no pun intended. Actually, I lied. That was intended. That was an intended pun. And then we have Sara Collins, who again is one of our sports injury prevention specialists and athletic trainers over at the McKaylee Center for Sports Injury Prevention. And so all of us work very tight-knit with each other. We share a lot of patients and clients, and we see a myriad of different medical issues in the running world altogether. And so we are happy to be here for you today. So we're going to start with, just so you know the agenda, Dr. Demacourt is going to come in with a little bit of an introduction first. Dr. Whitney will then talk about COVID-19's impact on exercise trends, pros and cons of running during this time, and some safety considerations. Then we'll work our way back to Dr. Demacourt, and he's going to talk about pros and cons of masks and what that might mean if we have to run with masks and things like that. He'll also talk about medical considerations. So if you had COVID-19 and you want to run, what that might mean, but then also other medical conditions like cardiopulmonary issues and heat illness concerns, especially as we head into the summer. So this is also timed very well. And then we will head to Sara Collins, who's going to talk a lot about breathing exercises and link that into mask use and stuff like that. So lots of good information for you tonight. After all the presentations are done, we are going to take questions. You can ask them throughout the presentation, and I will keep my eye out for those questions. And then at the end, say in the last 15 minutes, 10 to 15 minutes, we'll bring these questions to our panelists and they can answer them live for you. So feel free at any time to find that Q&A button at the bottom of your screen, type in a question, and we can put that on the docket. So that being said, I'd love to bring Dr. Demacourt into the picture here. So again, one of our Injured Runners Clinic doctors, avid runner himself. All three of these panelists are avid runners themselves. And I'm gonna let him do a little introduction for you here. So Dr. Demacourt, whenever you're ready, you can go ahead and take it away.
Okay, great. Hello, it's kind of weird giving a talk where I'm just looking at myself, but thank you for coming tonight. I think it'll be an interesting symposium. There's a lot of good folks that were just mentioned that I think will have great pieces to put together. I'm a primary care sports medicine doc at Children's, and I also do the running clinic, and I also work in the ultrasound unit with a lot of regenerative medicine. And so a lot of what we do with the orthobiologic regenerative things are meant for the runner, and so that's been a real a boost to keep us along. But what I'm doing right now is I'm going to talk about a little bit of history, a historical perspective. And I think when you get older, that becomes part of the game. You have to give the historical perspectives. So here we go. I would like to mention the first person that actually sort of got things going was Anthony Luke. And Anthony Luke was the second fellow that came out after I finished, and he did his fellowship, and he was very interested in a lot of the electronic types of medical records and things. And in 2010, he had gone to the University of California, San Francisco, and I met him in Seattle at the American College of Sports Medicine meeting, and he must have sat down with his computer and talked to me for about 3 hours on RaceSafe, which was a great RunSafe, which was a great program just coming about at that time to really look at the health of runners, look at their running styles, look at their nutrition, look at their strength. And it was actually a pretty interesting program. Actually, we started doing that in the evening. So we'd get these runners that would come in, and they would come in between 7 and 9 at night. I think it was Tuesdays and Thursdays, and we had a nutritionist there. Tom Vorder was the podiatrist there, myself, and we would go through all the different stations with a runner. And it was pretty good. I think we gave pretty good information. And then about 2010, Chris McDougall wrote the book Born to Run, and he actually wrote that book stimulated by a visit to Dan Lieberman's office over on the Harvard campus. He's the chief head of anthropology there, and he's just a fantastic guy. He spent 3 months a year in Kenya for probably the past 20 or 25 years, learning a lot about the running patterns and some of the safety in running with a lot of the barefoot type running styles. And so at that point in time, we really got interested in looking at impact and what the impact factors were in the runner. And at that point in time, we started to evolve into getting a treadmill that actually allowed us to measure the pressure peaks and see exactly where foot strike was. And this was following very much along with that Born to Run, barefoot running, Vibram type of thing. And since that time, we've evolved quite a bit where it's not like, every time you see someone, how they're running, you would necessarily going to criticize it. Jeptu, who won the Boston Marathon, if you look at her outwardly, you'd say, man, she's got a terrible running style, but she apparently doesn't have any pain. I don't take care of her, so I don't know. But that's just, she's adapted that way, and so that's fine. But when you have injury, then you have to think about what kind of a gait pattern might be contributory to that. And so we'd actually then, and this is a picture of Irene Davis, who was also very much instrumental in a lot of the theories that came around. She was at the University of Delaware, PhD in physical therapy. And then she's up here at Spalding. She's got a great running program over at the Spalding Clinic. And she, gave a lot of information. She helps us out with the marathon every year in the heat tent, does a great job there. And then I have to give special thanks to a guy who has just really been a big part of my life as a mentor and supported me in the running clinic, got me going with the ultrasound, sent me to Europe to learn how to do ultrasound. And then certainly developed the McKaylee Center. And I remember way back just before the McKaylee Center was decided to be open, he had been going through, and I'm sure he had already made up his mind at this point in time, but we bumped into each other one Saturday at the gym near the medical school. And he came over to me and said, and we talked about finances of it. And then we mentioned a couple things, and I thought, well, I think it'd be a really good idea. And then the week after that, of course, it got up and running. And I don't know that my saying had anything at all to do with it. He had probably already made up his mind at that time. I'm sure he had. But it was fun to then watch the entire progression of everything. And then, of course, there's Bill Meehan, and Bill is a superstar in getting the whole McKaylee Center up and going and functioning and making sure that all of the injury prevention aspects are there. He has he gets the whole thing going for, gymnasts. We're actually now going to be working with figure skaters, ballet dancers, pitchers, throwers, all of those in terms of injury prevention. And once athletes are injured, getting them back to normal. And so there's a picture of the McKaylee Center on the inside of the corner. And then I think that what's really made a big difference in how the Injured Runners Clinic works is these folks here. These are just tremendous physical therapy, athletic specialists who can actually get a lot of this information down in the McKaylee Center, looking at the treadmills and bringing it upstairs. So I have a clinic upstairs, and the athlete will come in, go down there, get a full strength and flexibility assessment, and then put them on a treadmill, and I'll get videos from them from front and behind, and then we make an assessment and decide what they need for any kind of injury treatment. And the doctors that are involved with this are Bridget Quinn, who does some of the female athlete triad and does a lot of that. And we have Kate Ackerman, who's one of our partners, who is very special. She does a lot of the female triad, she's actually an endocrinologist as well as a primary care sports medicine doctor. There's my other partner, Andrea Straccolini, who we occasionally run together and has developed along with our entire program as well. And as you can see her now, Dr. Whitney has been really very forceful and dynamic in this entire process. And our newest addition has been Adam 1040, who was at Stanford, who was actually a high-level runner at Stanford, and then came out. He did his PM&R fellowship and then sports medicine training, and he's joined us now. And he's very much interested also not only in the running, because he's really great with the running injuries, but he's also interested in the orthobiologic interventions that can help heal an athlete. So shockwave or different types of injections that will take care of tendon and common injury patterns to the athlete. And then comes COVID, and then this whole group panel tonight, we have been working for the past 3 or 4 weeks on putting together the virtual Injured Runners Clinic, which has been an exciting process, and we've done a few now, and it's seemed to work out pretty well. And it's very nice because you don't have to drive all the way into Boston or Waltham. That's it.
Awesome. Thank you for that, Dr. Demacourt. Super awesome to see that huge list of people. That really, it's like unbelievable how many people really contribute to our running program, for sure. So what I'm going to do now is I'm going to turn our direction over to Dr. Kristin Whitney, and she's going to talk a bit about the impact on exercise trends, like I said before, pros and cons of running right now, safety considerations, and things like that. So Dr. Whitney, whenever you're ready, go ahead and take it away.
Okay. Great. Okay, thanks so much, everyone. And thanks for that historical perspective, Dr. Demacourt. Is really super. So I'm Kristin Whitney. I'm also a primary care sports medicine physician in the Department of Orthopedics here at Boston Children's Hospital, working closely with the McKaylee Center Injured Runners Clinic. Here is a picture of our super team a couple years ago at the finish line of the Boston Marathon, working together to support runners on race day. But as Dr. Demacourt said, coined the phrase, he said, then along came COVID. So our talk today is going to turn to thinking about the context of COVID-19 and supporting our runners in the context of COVID-19. So Reflecting back over the past few months, I think it's pretty clear that it's hard to identify any part of our lives really that the coronavirus pandemic hasn't impacted. So it's impacted how we work, how we travel, how we celebrate, how we eat, sleep, relationships, and it's really impacted our level of activity and level of exercise across the globe. So the next couple slides are kind of interesting. They're aggregate data collected from Fitbit, which has movement data from over 30 million Fitbit users all over the world, where they kind of examined exercise trends and number of step trends per day and per week for different communities around the world. So this data reflects the week of March 22nd, end of March, where you can see globally there was a huge impact in terms of reduction in the number of steps of individuals. And this data is based on comparison to the year prior. So throughout Europe, major decreases in the amount of steps taken each day by different communities, with huge impacts in terms of activity reduction across Spain, Italy, Portugal, and France. The United States saw a 12% decrease in number of steps, and that is kind of on average across the US population. And not surprisingly, that impact in terms of reduction in physical activity was more major across the large US cities. So for example, San Francisco saw a nearly 20% decrease in the number of steps taken. New York, similar 20%. Here in Boston, we saw nearly 16% reduction in March 2020 compared to our average movement in 2019, the year prior, as well as major reductions in other large cities like LA, Chicago, Seattle, and Miami. This is another schematic that demonstrates the same thing in terms of how physical activity has been impacted in the United States by COVID-19. So here on the left side of the screen in black, this is the end of February, where things were kind of ticking along pretty typically in most US populations, where Fitbit mapped out this age-adjusted mobility change index, which is essentially a ratio of the amount of activity in 2020 compared to the same week in 2019, and the number of steps per day. So most US cities hovered up in this right-hand corner of the schematic. And then by the time April hit, there had been major reductions compared to the year prior in terms of the amount of activity in major cities and the number of steps per day. The green dots are indicate the cities that had either stay-at-home orders or strong, stay-home advisories, if you will. And as you can see, there were major decreases compared to the year prior in how much we were all moving, and major reductions in typical step count. And it's kind of interesting to look at different age groups and the impact that has been had on different age groups who have modified their activities differently over the course of the influx of the COVID-19 pandemic. So these two line graphs demonstrate changes in San Francisco up top and then New York below, and it breaks it out by age group. And interestingly, across time, so our time indicators are the first community spread cases in each community, emergency declaration in each community, state of national emergency, and then directions to shelter in place in these communities, which not shockingly, there was major decreases in the amount of physical activity. But I'll highlight that the changes in the physical activity was actually greatest in younger groups. So the 18 to 29-year-olds saw the greatest relative reduction in their typical amount of physical activity, followed by the 30 to 49-year-olds, and then higher age groups all saw decreases in their relative amount of movement and steps per day. And it was actually the greater change, or the greater delta, was seen in the younger populations. So why is this important? Why is thinking about physical activity important in the COVID era? So there's been some really interesting kind of articles coming out, opinion pieces, some coming out from China, who are kind of ahead of us time-wise in terms of their experience in this pandemic, who really stress the importance of maintaining regular physical activity while taking appropriate precautions. We'll talk about why. So first of all, the reduced steps, what we just demonstrated on those prior graphs, reduced steps have important health implications, even for short periods of time. So there's been many similar studies to this one, but I'll highlight one study where a research group took healthy research participants and reduced their total step count for just a brief period of time, for 2 weeks. They took active individuals who had been averaging about over 10,000 steps a day and shut them down to taking less than 2,000 steps a day. And in just 2 weeks' time, they measured very closely their physiologic response to that change in activity level. And they saw major changes in terms of reduction in their peripheral insulin sensitivity, which can put an individual at risk for things like prediabetes or diabetes or metabolic syndrome. They saw changes in terms of their visceral body fat, with an average increase in 7% visceral body fat over that 2-week time frame. And then they saw a negative impact on their respiratory fitness with changes in their VO2 max. And that was just for 2 weeks. And then, we kind of have to, think about how long we've all changed our activity level for in the course of this pandemic, and think about the types of health impact that this pandemic and activity modifications could have on a population-wide basis. Not only does changing activity levels does it have an impact on physical health, but it also affects mental health. Kaiser Family Foundation recently published a study that looked at reported mental health among adults who were experiencing the COVID-19 crisis, and there were major reports of negative impacts in almost 50% of adults who were sheltering in place. They reported major negative impacts on their mental health, or at least some degree of minor negative impacts. And even those who were not sheltering in place, so those who either lived in communities where there weren't shelter-in-place directives, or those who weren't able to shelter in place due to their job requirements or employment requirements, a large number of them, 37%, reported mental health implications with negative impact on their mental health. So that brings us to exercise. Exercise has been shown time and time again in research studies to have really important impacts on improving mental health. So it can reduce levels of stress. It can increase physical energy levels. It reduces depressive symptoms, increases mood, reduces anxiety, improves self-esteem, improves sleep quality, increases confidence ratings, improves cognitive function and overall well-being. So exercise is an important way that we can combat some of these detrimental effects of what we're all coping with these days. So to exercise or not to exercise, that is the question. So what are the other sides of the coin? What are considerations we need to think about when we're thinking about exercise? One is the effect of exercise on our immune systems. Okay, so one kind of going important theory in terms of exercise immunology is this quote unquote J-curve theory. And that is that there's a relationship between exercise and our immune function, and that there is, this is the J-curve. So individuals who are sedentary are about an average risk of infection. Folks who have a moderate level of exercise have decreased infection risk with some improved immune response in the setting of regular moderate exercise. But then when we go a little bit further than that to very high level of exertion for prolonged periods of time, there is the risk for a transiently weakened immune system and potential risk for increased risk for upper respiratory viral infections, which can occur on a transient basis. So for just a few hours after high level of exercise activities, there can be some increased risk at this tip of the J curve, okay? So there are several mechanisms and pathways that these changes in these immune function effects are manifested through. So our moderate exercise group, so moderate intensity level, moderate duration of exercise, it enhances immune function through several ways. So it increases our natural killer cells and our neutrophil cell counts, been found to increase salivary IgA or antibody concentrations, and it increases immunity against viral infections by changing how our T helper immune cells respond. Prolonged or intense exercise can transiently, for a brief period of time, impair immune function through changing the quantity and effectiveness of white blood cells, increasing production of reactive oxygen species, and lowering our glutamine function, which can decrease our immune defenses, our B cell and our T cell function, and decreasing antibody synthesis. Again, that's a transient response that isn't thought to be held over the long term. And importantly, in addition to all these factors, sleep, mental stress, travel, and nutrition are also really important modifying variables in terms of an athlete's immunologic status. So those cannot be ignored in terms of other important aspects of having a healthy and prepared immune system. So back to the question, to exercise or not to exercise, that's the question. So the answer is to find a balance, and the answer is in moderation, regular activity at moderate levels with appropriate precautions. So how can we stay safe and stay active at the same time? Well, for one, I've been extremely impressed with kind of the technological advances going on in the setting of this kind of global pandemic and how folks have responded in terms of, online availability, ways to connect online. There's online weddings, there's online baby showers, there's online everything, and there's lots of online opportunities to exercise. That includes online exercise classes, online personal training, things that we do through the McKaylee Center. There's things to do at home. There's yoga, there's high intensity interval training or HIIT. There's running with precautions, which is our topic for today. Walking with precautions, hiking, cycling, resistance training. There's all different ways to stay active and to do it in healthy ways. And it's really important to focus on those ways that we can stay healthy and active. So running with precautions, what does that mean? And Dr. Demcourt's going to talk more about this, but it means maintaining our regional social distancing guidelines, wearing a mask if not able to avoid crowded areas, avoid running in large groups, again, maintain your regional guidelines, avoid high touch surfaces like those traffic buttons, avoid spitting just as a courtesy and for reduction of risk for disease spread, wash your hands when you get home, and then it's not recommended to go running if you have a fever or have respiratory symptoms. And Dr. D will tell us a little bit more about this. Main takeaways: stay active, stay safe, and have fun. Thanks everyone for joining us this evening.
All right. Thank you, Dr. Whitney, for that super interesting information there. It's crazy how quickly they can just come up with these studies, even in just a few months. So now we're going to turn our attention to Dr. Demcourt. He's going to come back in now and talk a little bit more specifically about masks and other medical conditions if you've had COVID or if you have cardiopulmonary issues, taking in consideration heat illness and things like that. So Dr. Demcourt, whenever you're ready, take it away.
Okay, great. There's a picture of the Boston Marathon. About 10 o'clock in the morning, before any of the runners have come in, there's Dr. McKaylee, myself, Dr. Ackerman, and Charlie Baker. So about 10, 15 years ago, there was a guy named Bob Salas, who's still in practice out in California, who at the American College of Sports Medicine coined this phrase that exercise is medicine. And it's really just an amazingly true statement. For all the things that were just mentioned by Kristin, it's just a fact that you can prevent and treat a lot of illnesses with a good, solid exercise program. And I will reiterate what she said in the sense that kids have become, every time one of the kids or adult comes in my office and I'm actually working with them, one of my first sentences I ever get to them is, are you getting your exercise in? Because the exercise is part of my prescription of getting whatever it is that's broken. And always asking them, do you get 150 minutes a week of cardio? And I think that's really true. And that was the pre-COVID time. Now, in my telemedicine visits, because I get a little bit of hospital time now, but in my telemedicine visits, I ask those questions and they've markedly gone down. So I just am reiterating what was just said, and I think that's true. And exercise is really three components. It's cardio, strength, and flexibility. And Some people need more of one than the other, but really you want to make sure you're getting at least 150 minutes a week of cardio. The American Academy of Pediatrics says that each kid should be getting at least an hour of vigorous exercise every day. But don't forget about the strength, and this is really critical for running, and even in the COVID time, because you're in your apartment, you're in your house, you don't have much to go on, and so you need to have the strength gain and flexibility. For some people like me, I need the flexibility, and I've added yoga recently into it, but that can be an important component as well. So, is it safe to run outdoors? Well, of course, you want to follow CDC guidelines, 6 feet. If you're closer, you should be wearing a mask. But look at your regional guidelines, because some states are not letting people out except if they're in more isolated running types of areas. And you don't want to be running if you're having any kind of illness for your own particular health, because you could accelerate things as that your immune system is down. But more importantly, what we're going to show is that you may be getting other people sick as well. But now I think exercise is more important than ever. Again, not over-exercise, but exercise, as Dr. Whitney was mentioning. And it may very well help recovery. So if you do get COVID, you may very well recover faster. And there's some anecdotal cases out there. There's not really good science yet on the art of exercise in the COVID time period. But one thing's very clear, it doesn't prevent it. So just because you're outside running and you think you're the greatest runner in the world, you can still get it, and there are plenty of cases. And in fact, I remember waking up one night and hearing that on CNN that a guy that had run all 7 continents got COVID. He was about 45 or so, and rapidly died. And so it's not preventive at all, but it may make you get better faster. If you can't run outside, well, consider working out inside. There's plenty of things that you can do inside, stationary bikes, et cetera, that may be able to be helpful. I'm not going to go into too much detail here because it's already been covered, but basically, water fountains, don't do it. Carry your own water. I like to carry a little tiny bottle of alcohol with me just in case I get into a situation that I have to use it. I rarely have to use it. Group runs, probably not a good time for group runs. And we're going to get to that when we talk about the respiratory situation in just a moment. And as was said, no spitting. So what are the challenges? Well, number one is the geographic location. So if I want to go take a run, and I want to run on the Charles, that's a problem because the Charles narrows very much along, particularly out towards Waltham. So it's difficult to socially distance on that. Whereas on Common Avenue, it can get busy, but there's plenty of space on either side of the road that you can actually get off on and run. So I know when I'm running in the hills of Newton that I can socially distance myself most of the time fairly well. Covering your mouth and nose, and the reason for that is not because you are protecting yourself so much, it's you're protecting other people. So when you see someone that's not running with a mask, you can say, well, they don't really care, they don't believe in it. But the fact is what they're basically doing is they're putting you at jeopardy because the viral particles that come out of your oral secretions is quite high. And then what's coming out recently is this term super spreaders. So when someone exhales or coughs, there are basically 2 types of things that come out. One is the aerosolized kind, which is the very small microns of the COVID, and the other is the watery droplets. Well, the watery droplets are heavy, they fall to the ground, and they tend to not be a problem, and probably the mask that you have, almost any mask, is going to cover the droplets. But the microns, the small aerosolized, can hang around forever because they can last in the air for more than 3 hours. And as we get into really stagnant air of the summertime, I think that may become more of a factor. So when I actually am out running, I'm looking at everyone as a cloud of corona all around them. And so I sort of make sure that when I'm running, I distance. And if I see somebody coming at me without a mask on, even though I've got my mask on, I will cross the road in a heartbeat to stay away from them. And that's, maybe some of my own paranoia, but that's what I do. And that was an article that just came out in May, New England Journal of Medicine. So what can you do? Well, you can wear buff gaiters like the one up on the right-hand side, or I've gotten some family members send me some of these handmade cloth masks. The problem with them is that it sucks against your mouth, and so you go to inhale and you can't really breathe. So what I actually found is that when I went to the hospital, because I go about 1 day a week now, and they make you wear a mask, and of course they don't reuse it because they're not the N95 masks, they're just the mask, but they have these little stays in them, like on that bottom mask right there. So it pockets it away from my mouth. And I can do a 10-mile run with that and not have to worry about taking the mask off up and down if you have a pocket. Other things that you can try, I don't think they work for me, but you can put these little nose bridges like you see Meb here, who won the Boston Marathon in 2014, last American to win that. I don't think I can do that. And you're going to hear in a moment about different solutions. Maybe you can breathe in through your mouth and then breathe out through your nose, or as what's going to be discussed is just get better breathing training, which may actually enhance your performance anyway. So Sara will talk about that in a few minutes. I just noticed a few things out. I have no idea how effective they are, but there are some new sports masks that are out. One was made by New Balance, and that looks to me like it keeps a pocket in front of your face. So I think that would be something potentially effective for breathing, again, with that same principle. So what if you get corona? So then what are you going to do? What are you going to do for running and exercise and all those kinds of things? Well, at least 80% of the people have mild disease, symptoms lasting about 2 weeks, and then if you're more severe, 3 to 6 weeks. But then when can you really get back to running? Well, there's really no data I could find on that, except I just went through Runner's World, and there were tons of little anecdotal cases. And what it seemed to be is that the earliest that some runners got back was about 2 to 4 weeks. But almost every single one of them said that it was at 3 months, they were only about 75% back to normal. So it really can suck a lot out of you to get that, to have the problem. And it's probably due to the fact that COVID affects the heart, brain, lungs, and kidneys. And one UK study showed that for those, so 20% of people get hospitalized. And of the ones that get hospitalized, 45% of them needed post-hospital care because of ongoing debility that was from that. So what's happening here? So when you get COVID, this first week, your viremia spikes up, right? And you may be mildly symptomatic, you may be asymptomatic at all. And one of the studies that are coming out right now are showing that this is where the asymptomatics are probably giving away the particles as those silent spreaders. And so one of the studies done in Wuhan looked at 58 asymptomatics. So they were people that were tested for corona, tested positive because they were exposed to it, but had no symptoms at all. So they took 58 of those people who went in and did CAT scans of their chest to look for signs of findings on CAT scan indicating they were infected, and 95% of them had CT lung findings. That's huge. And I was just reading literally an hour before I started this conference, Apple News put out something where in California they're worried about this super spreader because 20 to 50% of the people may fall in this category of being viremic and being infectious, but not really aware of it. So that's when I'm running along and I see another running coming at me without his mask on. I'm like, oh man, could be a problem. Why? Because not only may he be an asymptomatic carrier, but think about it. He's taking a deep breath and blowing it out in my direction. And so to me, I think that's a problem. And I think you have to respect that. It's your responsibility to be aware of other people. And I think that's, as a healthcare professional, I've got to be responsible. And I think all runners have to be responsible in this respect for continuing to watch out for that kind of a spread. What happens with the lungs? What happens is the coronavirus, which looks like a crown, that's what's called corona, attacks, and everyone has a lot of ACE2 inhibitors in their hearts and lungs. And this ACE2 inhibitor is immediately attracted to the coronavirus, which then goes in. And this little round area here is the final oxygen exchange area of your lungs, called the alveoli. You've probably heard about it in the news. And what happens is that they have a lot of ACE2 inhibitors there, or ACE2 receptors there, and the corona binds there, and then you see the swelling on this side. It just develops. So there's two different things that happen in the lung. Number one is regular old pneumonia, where you may see patches out in the periphery here of pneumonia, or you can get into an ARDS situation, and you probably heard that in the news, where you get this, so your lungs are so swollen you just can't get air. And that's a fairly small percent, but it's a fairly large percent of people that actually, well, it's all the people that are on the ventilator. And and that gives this sort of, instead of being a nice black lung, it's like kind of this brown glass appearance. Now, in a lot of people, this clears and it goes away. But so what happens on a long-term basis? Well, we're still finding that out now, but experience from another coronavirus, the SARS and the MERS. SARS was in 2003, that about a third of them had long-term scarring. So, some of these people are end up scarring, they would be a little bit more short of breath than others. And the risk factors for that seem to be hypertension, asthma, and older age. Another thing that just recently came out is that this whole thing goes way down if you have high levels of vitamin D. So what they did is they looked at some countries that had low vitamin D levels, such as Italy and Spain, and they had very high incidence of these problems versus countries that had very high vitamin D levels and they don't. There was another study also done in Wuhan that looked at their hospitalized patients, i.e. their more critical ones, and the ones that were intubated in a more critical situation were the ones that had low vitamin D levels. So, you know, your normal vitamin D is probably 600 to 800 a day. I take about 1,000 a day, and I think I'm just going to increase mine to 2,000 a day, at least for a while this is going on. That's not a level you can't get over toxic to it. I heard a couple stories, very rarely, but I think 2,000 a day is probably not unreasonable. Running concerns from your lung standpoint is don't start running until your symptoms are resolved. Okay, and you want to stay active. So find some things to do. Like there was a intensive care doc out in Washington that talked about even patients that were ventilated he was encouraging them to strengthen their legs because they were still fairly conscious and get them moving and get some level of activity. And there was one anecdotal case of a urologist at Montefiore Hospital in New York who got it pretty bad, but he wasn't intubated. But he tried to come back running afterwards. And what he found was he had a spirometer, and there's something called your tidal volume, which is how much air goes in and out of your lungs. Well, his tidal volume was about 400. A normal non-exercising person is about 500. And when you're running, it's probably 1,500 or more. So it just showed that his capacity took him a long time to actually get that back. As far as your heart goes, it also has ACE2 receptors. And so you can think of two different kinds of cardiac things that can happen. You get a heart attack with arterial blockage because what happens is you may have some underlying cardiac blockage there, and then you overtax the heart because it has to beat so hard with all the febrile illness, et cetera, so you can get a heart attack. But the worrisome thing is actually the myocarditis because it attacks the muscle. Now, in athletes now we know they can get myocarditis from a different bacteria or virus called the Coxsackie virus, but the ACE2, the coronavirus seems to attack that and give a pretty good myocarditis as well. One Wuhan study showed 12% of hospitalized folks had those signs, and one University of Texas study showed about 19%. So if you've had any kind of a significant case of COVID, it may be worthwhile talking to your primary care about possibly getting an EKG. I'm not saying everyone needs an EKG, but certainly a consideration. And if there's exercise intolerance, you may want to get an echo or even a stress echo. But the most important thing is to start back slowly. And then heat stroke is something that we see, and I'll just go through this because I think I'm just about out of time. But so in the marathon, one thing we see year in, year out on hotter years, but it's also the intensity of the runners, the fast runners that are finishing the marathon in 3 hours, a little bit more. Their temperature shoots up over 104. They become mentally out of it. And it's a very critical, life-threatening situation with a very simple, easy cure, and that's sticking them in a tub. And what we've noticed before COVID time was that there was some association. These are just different ways you can cool. You can dunk them in a tub, or you just got to get ice all over them. What we've noticed before Corona was that viruses seem to be associated with it. Marty Schwellnus down in South Africa did some work with that. And then Chevron from the US Army out here in Natick reported on some cases of heat strokes in athletes, particularly associated right after a viral illness. So we don't know what Corona is, but we've got you got marathon coming up in September, October. You may very well be at a higher risk if you've had Corona for a heat stroke. And so in summary, protect others. You got to protect your responsibility to protect everyone else. You can't just say, well, I don't care. I'm not, I don't believe in all this, because when you're out there, you may be carrying the virus and you'll be giving it to other people. You want to follow local guidelines, stay indoors if you have to, but make sure you get your cardio and strengthening in. There are plenty of programs to do that. This is probably not the best time to PR, just as Kristin was saying. So run, but don't run. You don't have to run, your marathons. Listen to early symptoms, and if you're sick, isolate and monitor symptoms, and don't push high rates too soon. Discuss with your PCP if you do get it. Thank you.
Awesome, Dr. D. Thank you, Dr. Davenport. Thank you very much for that. if you don't mind, could you stop the share on your screen?
Oh yeah, sorry.
No worries. Perfect. Awesome. Okay, so just a quick reminder before I have Sara Collins jump in here. I've gotten some questions. Thank you. But if you do want questions answered, type them. If you go to the bottom of your screen, it says Q&A. You can enter your question there. And again, when Sara Collins is done speaking, we'll enter the question and answer forum. Unfortunately, if you raise your hand, I'm not going to be able to call on you or anything like that. So if you do have questions, please use the question and answer tab, and we will get to your questions right after Sara Collins is done with her presentation. With that being said, Sara Collins, one of our sports injury prevention specialists at the McKellie Center for Sports Injury Prevention. She is up next. And Sara, whenever you are ready, go ahead and take it away.
All right, here we go. The moment we've all been waiting for, breathing exercises. All right, so my name is Sara Collins. I'm one of the sports injury prevention specialists at the McKellie Center for Sports Injury Prevention, and I work closely with Sara, Dr. Whitney, and Dr. Deb McCourt, working with runners. I have a specialty in running. I'm a runner myself, and yeah, I just love everything about the Boston Marathon. So I thought it'd be important just to start with a brief, just like anatomy and physiology reference here. So just real quick, when we're inhaling, we have oxygen going into the nose or the mouth, traveling down through our glottis into the trachea, and then where that spreads out into our lungs to the right and left bronchi, and then eventually end up in this tiny little air sacs called our alveoli. What happens, where we're really going to be focused on, is the musculature today. At that moment, that's when the diaphragm expands and the external intercostals will contract. So that's going to cause the belly to get larger, and that's going to cause the lungs to expand more, to get more, make some more room for air. When we exhale, it's a passive motion from the lungs. So when we start our exhalation, the diaphragm and the external intercostals relax, everything comes back to its relaxed state, and we expel carbon dioxide. So like I said, our main focus is going to be on respiratory muscles. And there's different types of muscles that come at different times when we are breathing. So our primary respiratory muscles, in other words, what are used during our quiet breathing. So basically what we're doing right now, just kind of sitting and existing and breathing. Our diaphragm, like I mentioned, when we inhale, it contracts. So it moves downwards and out. So it's going to increase the space in your chest, and it's going to pull the rib cage up and out. As we exhale, the diaphragm is going to move up and relax, and then it's going to decrease the space in your chest. And your external intercostals help with that motion as well. Now, as we become a little bit more active, so this is obviously important to our running community, but this can also apply to any type of exercise, even walking, other muscles start to get more involved. So that's when we're looking at our internal intercostals, our abdominal muscles, basically all of them, and our quadratus lumborum, which is a muscle in your lower back. They also help create more space for the lungs to expand, allowing you to get more air there, and also provide some needed stability when you're doing activities. Our accessory muscles, they actually oppose the diaphragm. So these are muscles that are primarily around your clavicle and up in towards your neck, and it's a sign of abnormal breathing. So this is fairly common if you have a known pulmonary like pathology going on. It's not very common in healthy folks, but we can still see some people breathe a little bit through the upper chest as there is their stasis for breathing there. And then to summarize the rest of the muscles, you know, we have our mouth, face, and pharynx involved there. So breathing patterns. So you probably never really think about how you're breathing and how important breathing is doing or is for you. And one thing that all of our injury prevention specialists at the McKaylee Center tend to focus on a lot, especially if you have somebody who's been working with a chronic injuries. We'll take a look at how they're breathing, because it gives us a good idea of how they're functioning, specifically in their core musculature. And then we can work our way out from there. So the big breathing pattern that we're going to be talking about this evening is diaphragmatic or belly breathing. This is probably something that you've heard before, especially if you've ever taken a yoga class. And what we're looking at with the diaphragmatic or belly breathing, as you can see in this diaphragm here, as the air comes in, we want to be able to increase the space in the chest in order to allow for as much air to come in, so then we can fully empty the lungs out. So we're able to use all of our muscles for that. The most common type of breathing pattern is thoracic chest or clavicular breathing. So that would be somebody, if you watch yourself, and I know that you're all sitting at home right now, really thinking about how you're breathing. Where am I breathing right now? So our thoracic breathing, that's when the rib cage might expand laterally, which is a good movement pattern to have, but we might not notice that the abdomen moves at all when you breathe. And this can be really prevalent, maybe not necessarily when we're sitting or standing, but when we're lying down. And then masked breathing is when the secondary muscles, or those active muscles that I was describing, so some abdominal muscles, the quadratus lumborum, become overactive, and they cause your respiratory muscles to kind of flare out. So this is a great diagram of a rib flare, which is another common thing that we see at the McKaylee Center with a lot of our runners, actually, where their ribs will stick out. And what that is that's just, we have to retrain those muscles to actually stay down, and then teach them how to laterally expand and work through the belly here, where this is likely something that's getting overused and could be contributing to something like, you know, improper posture when you're running or walking, and can even, you know, affect the way that your gluteal muscles and your shoulder muscles and all of and a lot of things work. So that's why breathing, you know, at the McKaylee Center is one of the primary things that we look at first. It's really important. And then the last breathing pattern we have is paradoxical breathing. So like I mentioned before, this is pretty abnormal. This is when you're breathing and instead of the chest and abdominal wall moving up and out, it's actually when it comes in. I have seen, you know, healthy individuals have a pattern of breathing like this before, but it's very, very rare, and it's usually indicative of a disease or injury to the lungs. All right, so moving on, now that we have our anatomy down here, moving on to exercising with a mask. So just to complement everything that Dr. Demacourt and Dr. Whitney was talking about, you know, what do we do in this situation? So with normal breathing when we're running, I'd say most people are breathing through their mouth. It's actually the recommended way to breathe. Inhale through your mouth, exhale through your mouth. But in these times when we're breathing in and exhaling through our mouth, we're going to release more particles into the air, even if we are wearing masks, which does a good job protecting it. But with the mask, your airflow is going to be restricted. Right, so this is why we're playing with the idea of, well, if we breathe in and exhale through our nose, that's going to support diaphragmatic breathing very well, which is what we'll get into in a moment. And also there's going to be less expenditure out, so less chance of expelling more of the virus out if you happen to be an active carrier in it there. So it's hard to just breathe through your nose when you are doing an activity. So I imagine as we're exercising with a mask, it's potentially going to be a combination of both. And how much your air is going to be restricted in either way that you're planning on breathing depends on the thickness of the mask. So like Dr. Demacourt mentioned, you know, having like a standard hospital mask that tense is going to allow that to sit a little bit farther away from your face, which is probably going to allow you to breathe a little bit better as opposed to having something stuck to your face. And especially now that we're in warmer weather and, you know, we sweat and everything like that, that's going to get stuck, and that could make it more challenging. It also depends on your metabolic breathing efficiency. So in other words, how your body kind of is able to take in oxygen and use it for processes that you need for exercise. So breathing is a pretty important thing when it comes to running. About 10 to 15% of our running demand. So you can see that how not having the best oxygen intake or functional breathing patterns can actually negatively affect our performance running. Less oxygen intake means that there's less oxygen in our bloodstream to meet the demands for physical activity. So that also means that our lactic acid is going to increase when our oxygen goes down, which could complicate things with fatigue and cramps. And then, of course, wearing a mask might cause some shortness of breath and lightheadedness and dizziness. But there are, as I think we're all looking at during these times, there are always some silver lining in this, or potential silver linings here. Wearing a mask could potentially mirror what we would see with altitude training, or maybe wearing an oxygen deprivation mask. So that's a mask that you wear where you can alter how much airflow is coming in and out, and in turn it's supposed to increase your metabolic breathing efficiency. But it is important to note that if you are going to be exercising mask and working towards getting more comfortable with it, that it is going to take some time to adapt. And again, this is something that's, all of the science is still fairly new to us. But again, there was one article that I'm referencing from Runner's World where there's potential for us to metabolize our oxygen better after a few weeks of consistent training, and that's about 3 times a week. No specific time, but just getting out there and practicing 3 times a week. So there is potential for us to have a little silver lining in this, that we all could come out a lot faster and more metabolically efficient. So I'm looking forward to that day. Next, we'll talk about our diaphragmatic breathing. So we're choosing to talk about diaphragmatic breathing because there is the most evidence out there in terms of how beneficial it can be. So diaphragmatic breathing is the most efficient type of breathing, which is why it's our gold standard. And what it does is it decreases your breathing rate, therefore decreasing your energy expenditure, it takes to breathe, and your demand for oxygen. It also has benefits to our central nervous system, where it decreases our sympathetic activation or our fight or flight, which, if any of us have experienced when running, and maybe you've even experienced this when you first started wearing a mask, that you start to kind of get like a little puffy, almost an anxiety feeling. That's that fight or flight kicking in. But starting to slow the breathing down with diaphragmatic breathing will increase your parasympathetic response, or in other words, just your ability to calm yourself down. So that in turn can decrease our blood pressure and heart rate. It also supports stress reduction and relaxation. And again, because you're using your muscles more efficiently, so likely your posture is going to be lining up a little bit better. It's going to help improve your core stability and exercise tolerance. So I thought what we would all do is practice some breathing techniques and review some. So the simplest one is just either seated or supine or lying down on your back, diaphragmatic breathing. So I won't be demonstrating the lying down one, but what that one would look like is you lie down, make yourself cozy, bend your knees with your feet flat, and just simply rest your hands on your stomach. And then you breathe in through your nose for about a count of 4 or 5. And then exhale out your mouth for about the same there. So we can practice the seated one together a few times if you'd like. You can put one hand on your belly, one hand on your chest, just so you can see the rise and fall. The belly as you inhale, the belly should rise first. And then as you exhale, the chest will fall first. And inhale through the nose and the belly will puff out. And then exhale out your mouth and everything comes on back. So I'll let you guys work on that while we're going through the remaining breathing exercises. But that is its simplest form of practicing diaphragmatic breathing. And like I said, it's pretty relaxing. You can do it anywhere, and there's no limit to how much you can do because, well, you're breathing. Another really functional type of breathing, which is taught to a lot of, that has a lot of data out there that's been helpful for those who have asthma, COPD, or blowing out your birthday candles, as Miss Brittany is showing us right here. So it helps get the trapped air out, which if we're in a mask and we're out, it's important to try to get as much air out of the mouth or out of the lungs as possible there. So very simply put, that's inhaling through the nose, and then you're gonna make your mouth almost as if you're blowing out of a straw, and you want to have a little noise associated with inhaling, and then out quick like you're blowing up birthday candles. Good. And of course, there's more exercises to go through. So other popular exercises here, and I'm sure to some degree we've all heard of these. Crocodile breathing, that's when you are lying prone, as this model is demonstrating here. And what we're looking for in crocodile breathing, inhales, you're going to feel your belly expand against the ground, but you're also looking to open up through the back there. So making sure that you're getting, because we never really about how the back of our lung important is to expand as well. So this will help train so you lungs much more efficiently. Lateral breathing. So that is working, as this woman's demonstrating here, hands on your rib cage. So with the focus here, you'd breathe in, you'd feel your rib cage expand, and then as you exhale, you'd exhale forcefully and use your hands to help bring the rib cage back. So it gives you a little bit of resistance to work that way, all the while you're thinking about bringing the belly up and down with your breathing. Intercostal stretch, as you know, as I noted in our little anatomy lesson earlier, super important muscles when it comes to respiration, but also can be a bit on the tight side. So if you find, especially now that we're sitting a lot more, if you find that the sides of your bodies are a little tight, you just raise your arm up overhead, lean over, and then just imagine breathing into your side body and trying to get that expand. Not uncommon to really feel it stretch, or sometimes there's a couple pops that happen because it tends to be an area that is really tight on us. This little guy over here is doing a perfect description of blowing up a balloon. I did think about doing that, but I saw everything going wrong with it, so I thought that this image would be a much better demonstration for all of us. So taking a balloon or a glove if you have one of those lying around, and then just practice inhaling through the nose, exhaling out so it blows up a little bit. Inhale again, don't suck in all the air, and then exhale and stop. Inhale, exhale, and stop. And you might find that it's a little harder to do. That is kind of like our advanced exercise for breathing, but give it a try if you have this stuff lying around. Two exercises that I have noted at the top. These are, I'm gonna give live demonstrations of these. They kind of couple in the breathing patterns along with some mobility and flexibility work for the shoulders and back. So the stretch, I'll turn sideways so you can see here. You're gonna take your hands and you're gonna clasp them so the palms face out. And then you're gonna round your back, almost like you're pushing your hands out in front of you. And then as you inhale, you're gonna inhale, the arms are gonna come up overhead, feel the belly push out, but keep the rib cage down. And then as you exhale out through the mouth, you're gonna feel the lungs come back around the shoulders there. So inhale and exhale. All the while watching that rib cage doesn't wanna pop out on you as you rise the arms up overhead. And then the reach and stretch, you're gonna inhale the arms up overhead. Again, feeling the good opportunity to practice some of that lateral breathing there. And then exhale, you're gonna bend the elbows, keep the chest open, let the shoulder blades slide down your back, and almost like you're trying to put your elbows in your back pockets there. So then that way you can keep everything nice and wide here. Inhale as you breathe in, arms go up, and then exhale, stick your elbows in your back pockets there. Also great ones to do if you've been sitting on Zoom calls all day long and everything starts to hurt, just break out to the reach and stretch and flying W's and you will feel like $1,000,000. And then the last breathing technique I want to go over is there's a couple alternative breathing techniques. So these I thought it would be fair to mention since there has been a bit of an uptick in people trying yoga since we're home now. So if you're familiar with yoga, Ujjayi breathing, so that's kind of like that Darth Vader breath where you're just, for both these techniques, you're actually just breathing in and out through your nose. And then alternate nostril breathing, which is what this picture demonstrates here. So these are a little bit more of the advanced practice. There's a lot of studies out there that recommend that these two styles of breathing are great for stress reduction and improving mental clarity. So that would just be great to have, right now during these times, or really any time here. But they also employ just a different style of breathing, of diaphragmatic breathing that is just a little less talked about. So if those are things that you are familiar with and comfortable practicing, there could absolutely be some added benefit in continuing doing those breathing practices. So recommendations for these breathing exercises: inhaling through your nose, exhaling out through your mouth. You want to keep your jaw relaxed. Start low. You don't have to do many of these. So I start people with like 3 to 5 breath rounds. So that's an inhalation plus an exhalation, just doing that 3 to 5 times. Give yourself a little break, because we don't want to make you lightheaded with any of this here. And then eventually over the course of a few weeks, you should be able to get up to 8 to 10 breath rounds, being able to repeat this. Not necessary to go any more than that there. Once you get more comfortable with breathing techniques, try to make your exhalations longer. So that would be, for example, like breathing in for 4 counts and then exhaling for 5. So you can empty out a little bit more. And then the bonus is, since we're breathing anyways, we can do these multiple times a day if we'd like. Now, I thought it'd be important to also give some recommendations on how we would train wearing a mask. So one thing that I've tried myself, and I've recommended to some of my clients who are runners who are having a difficult time wearing a mask, is just to go for a brisk walk wearing your mask and practice only breathing in and out of your nose. It's hard to do. There's going to be a few slip-ups, of course, but then that way you can just kind of practice inhaling and feeling your belly breathing. So in turn, it's almost just like doing resistance training, just for your lungs and for your diaphragm. So that would be a great place to start. And of course, once that breathing pattern, like I said, if you need to breathe out through the mouth, inhale through the mouth every once in a while, that's okay. But that would be a great place to start. Another helpful tool would be using a breathing ratio. So that's inhale to exhale. So again, I found this through Runner's World, where you would inhale for a count of 4, exhale for a count of 4 for a minute, and then inhale for a count of 3, exhale for a count of 3 for a minute, and then 2 and 2, and then you start at 4 again. If you start to experience some lightheadedness, or it just gets challenging, or you start to get tired, either walk it out and calm your breathing down back to that 4-4 pace, or try a walk-run program, which I think is also just important to know now that we are getting into warmer temperatures as we experience today, plus allergy season and mask wearing. So things couldn't be better right now with all of this. It's just important to just take a step back if you need to, if you find yourself struggling a little bit with it. And just practice doing that. Our more well-conditioned runners can play with the ratios a little bit, focusing a bit more on exhaling a little bit more quickly, or maybe starting at more of like a 3-3 pace, if you like there. All right, and then as I mentioned, diaphragmatic breathing style really helps with posture. So I think it's important to complement our diaphragm by making sure that we have good posture. So simple things like doing, you could even do, like I have here the cat-cows, either seated or on hands and knees. Great opportunity to practice your inhalations and exhalations. Simple things like a chin tuck. So that's just simply just moving your chin back. That'll help strengthen up your rhomboid muscles and back here. Sliding the shoulder blades together. So you don't want to think about squeezing the shoulder blades together, because this isn't how we're going to function. You want to slide the shoulder blades together, perform a chin tuck, and that will actually help with the posture there, and you'll be able to breathe a little bit more efficiently. And added bonus, it'll also help you stay a little bit more upright when you're running. Also important to keep up with core strength, glutes, rhomboids, and your lats. And stretching out your chest, the front of your neck, your hip flexors, and your low back. Another thing that you can substitute out for is, instead of, holding a plank for 30 seconds, try doing breath rounds. So that's something that I commonly do with my athletes, mostly just to make sure that they are in fact breathing during the exercise. But also, if we breathe, like I mentioned, our nervous system is going to respond positively to that, and it's going to allow us to relax into the exercise, so it's not going to see it as threatening. So in turn, it actually might make doing a plank or some other beloved exercise a little bit easier. So maybe doing 8 breath rounds while you're holding a plank, it actually equates to about the same time. But at least we know that you're breathing, and you're kind of getting 2 birds with 1 stone at that point. All right, so precautions for going out for a run with your mask on. Just make sure that you talk to your doctor if you have any pre-existing pulmonary restrictive airway conditions, just to make sure that exercising outside is a good idea for you. And I would always, check and just see if they have any recommendations, if there is any concern, like I said, especially with allergy season upon us right now. And if you do, I would just start very low with the breathing technique, just breathing while you're walking there. And one unfortunate side effect of this and adapting to this is that you might experience some dizziness, lightheadedness, or shortness of breath, or some increased fatigue. But if that doesn't go away, or it persists and it happens every time you exercise, it's best to just touch base with one of your physicians. So just to reiterate everything that I just said, that running with a mask is going to take a little getting used to, both personally and physiologically. So just be patient with it. Make sure that you're listening to your body. There is no need to push yourself right now, but listen to your body, especially as we're getting into warmer weather. Push that belly out and strengthen up that diaphragm, and just keep on moving. And then I know that Sara Carpenita talked a little bit about the McKaylee Center, but just wanted to share that, we are offering virtual private training lessons, group training, and exercise classes right now. We are offering 2 exercise classes right now. Strength and Stride is a class that is geared more towards working on general mobility, flexibility, stability, and strength, basically all of the things that a runner needs. And then we loop in some running drills that can just help you increase your awareness in terms of what you're doing when you're going out for a run there. And our Never 26.2 Prepared class is geared towards our marathon runners, especially since the fall is going to be quite the season this year. That can be helpful in terms of how to care for your body when you are doing a lot of running, especially since training season is right around the corner for our fall marathons, and we might have a few back-to-backs that you weren't originally planning for when you signed up for all of those. You can reach us at our phone number right there, or you can always email us info@themcayleecenter.com for some more information and get signed up for some virtual classes or for some private training. So thank you, everybody, for coming and listening to us, and I hope that this presentation was helpful.
All right, Sara Collins, thank you so much. Thank you to all of our panelists here, and just staying, because I know I'm very aware of time, and so we've been on for a little over an hour 15 minutes here, but I do want to get to some of the questions quickly, so we'll be concise. But we'll try and get to all these questions because there are a couple really great ones. So I guess just a clarifying question, because I'm sure a lot of runners out there are not huge fans of wearing a mask when they run. So just one attendee asked for a little bit of clarification. Are you suggesting wearing a mask running even if you are clearly socially distanced? And anyone can take that.
I'll take that. So I think if you are socially distanced, then the law in the state of Massachusetts is that's fine. You have to put a mask on if you cannot stay more than 6 feet away. What I see, though, is a lot of people that are very close together. In fact, there's some people running together. That's one thing. But then running, not really thinking about people coming at them. So I think if you're going to not wear a mask, you need to stay the distance. What I do sometimes, before I actually had this one thing to give me the pocket, one of the things I would do is I'd wear the mask and I'd pull it down until I saw that I was getting close to somebody, and I pulled it back up again. And I see a lot of runners doing that. That's very appropriate.
Any other thoughts from at any time, Dr. Whitney? And
yeah, I agree. I think
jump in.
having a unless you're running in the middle of the woods, running on a country road where you're not going to see anyone else for miles and miles, I think having a mask on hand, so if you cross paths with other people or run in near proximity to other runners, having a mask on hand so you can put it on when running nearby others is a good approach.
Gotcha. Okay, so next question. I had a couple questions about age range. Are the prevention and safety measures the same for the youth population, say, the teenage population or maybe even younger, who are doing maybe shorter track and field running activities, or like what are the risks for youth athletes with wearing masks during exercise?
Well, you want me to take that, or do you want Kristin?
Sure. Yeah, you can go first.
Okay.
Oh, well, I was going to say, I think the guidelines are generally the same for the youth and the adult population, as we've discussed. I think there's been a lot of careful consideration in terms of rollout for youth sports programs and different approaches for how youth programs will be safely launched. But I think a few things, especially for young children, I think it's important to be aware of kind of age differences in their developmental levels in terms of things like masks becoming wet with condensation when they're running. They may not be as aware of repositioning, hand washing, things like that. So I think there are some things to be aware of when you're dealing with any children, especially younger children. But I think in general, many of the guidelines are the same or are being carefully tailored to different age populations and sporting groups.
Yeah, I think the younger kids are not getting as sick for the most part, but they can be the carriers, right? So they could get viremia and be the carrier, be the spreaders. And the other, there is a small. This is not really pertinent to that question, but there's a small group of kids that get this multiple organ inflammatory response, similar to something called Kawasaki's disease, which is a small number, but it's there, and it's definitely being reported across the country, where it affects heart, kidneys, extremities. So anyway, so I think the bottom line is you take the same precautions, and almost all sports organizations have designed some level of a phased return to sports, depending upon the local geographic situation at the time. So there's early settings where you get together just a few people and then gradually build it up more and more. But we're waiting to see what happens this fall. So with regard to soccer, football, and all that stuff, it's going to be very interesting summer.
Perfect. So I do have a couple questions in terms of vitamin D levels. So are vitamin D supplements recommended for people of all ages or just the at-risk population? And then another question for vitamin D levels, what is considered high and low from a general standpoint?
So in terms of vitamin D levels, so cutoff for frank vitamin D deficiency is less than 20. However, levels from 21 to 29 is considered insufficient, with levels above 30 being the goal normal range per the endocrine society guidelines. So above 30 is the goal, and that's particularly in athletic populations where both their bones and their muscles are making regular use of vitamin D. So you want to shoot for above 30. Above 80 is considered high vitamin D. It's rarely seen, and I think so. Maintenance dosing of vitamin D is anywhere between 1,000 and 2,000 international units of vitamin D a day, depending on which society guidelines you reference. But I think certainly for anyone who's had a history of low vitamin D or lives in geographic area where vitamin D levels are prevalent, like New England, where we very rarely get exposure to adequate levels of UV light, even in the summer sunshine, it can be a good idea to supplement with some amount of vitamin D, either 1,000 and 2,000 international units a day, or just a multivitamin to make sure you're rounding out your diet. It's very safe, and not a bad idea to supplement to make sure that you're hitting the goal level.
Okay. Perfect. So last question here. It's a little bit technical, but it's kind of related to that Fitbit study. So if we use data from Fitbit to identify changes in activity levels, do we miss the possible uptick in activity from generally non-active people who normally wouldn't use a tracking device?
So I think it's a super interesting point, and I agree that I think that there could be some like selection or population bias in the Fitbit data sample. So maybe there's something about the a person who wears Fitbit regularly versus those who don't. So maybe we're seeing some selection bias in that data sample. I think it's a really good point, and the data set is not perfect. There have been other survey studies that have been done with thousands of adults in the US, asking for adults to report their change in activity level in the setting of COVID. And they've shown similar trends. So adults self-reporting, about 40% of adults report that in the setting of COVID, their activity level has worsened or gone down. About 50% of people say that there's no change in their activity level, but about 10% say that they're more active than before the pandemic started. So I think it's a really good point. Some people might have an uptick in activity. They've got more time on their hands. And I think it's a really important point to bring up. Thank you.
Absolutely. So with that, I think we can conclude our talk for tonight, running considerations with COVID-19 or during COVID-19, not with COVID-19. But any closing remarks or comments from the panelists?
No, thanks so much for the opportunity to talk about these topics and think through some of these topics. And thanks everyone for joining us.
Yeah, thank you very much.
Awesome. So with that, I will just say if you need any further information, you can always visit our website at the Division of Sports Medicine at Boston Children's Hospital, and also the McKellyCenter.com. Thank you to Sara Collins. Thank you for sharing that last slide there with all of our contact information there. I'm glad to have you. But then also thank you so much to Dr. Damacourt, Dr. Whitney, and Sara Collins for joining us tonight and giving a very valuable and topical talk about exercise and running during this tough time. So to all of our attendees, thank you so much for coming. We had a great showing, had great questions, and please know that we're here for you during this tough time. So if you have any further questions, please don't hesitate to reach out. We are definitely here for you. So thank you again for coming, and hopefully we'll see you all at the next webinar.
Bye. Take care. Good night.
Take care.
Night.